All right, good afternoon, everyone. We've got Phil Cawley running the afternoon session, who is a coordinator at Lancashire Police for restorative justice. So Phil's going to speak for about 20 minutes, and then we can have 10 minutes of questions at the end. But feel free to put things in the chat box as you go along, and I'll monitor the chat, and then we'll put some of the questions to Phil at the end.
Super.
Okay, great.
Okay.
I'll let you start.
Right. Good afternoon, everyone. Thanks very much for joining me. As Sarah said, I'm Phil Cawley from Lancs Police. Up until 2011, I was a police officer with Lancs. I've been police officer 30 years. And then in 2011, I retired for the first time and came back doing restorative justice. I'm assuming that you all know what restorative justice is, and I'm going to keep it in simple terms about victims and offenders meeting. So when we initially started Lancashire, the Lancashire RJ team, we were coordinators for the police officers and the PCSOs who ran all the restorative justice meetings. And the meetings were for what I would describe as low-level antisocial behaviour, low-level offences. And that's what we did for the first couple of years as coordinators. A couple of years into the job, I managed to get some training for myself and colleagues, some joint training with the probation, the prison service. And from that point, really, we really as a team began to take off. We started doing restorative justice meetings out in the community with more serious offences, and also running meetings in the prisons in conjunction with the probation service and prison staff. So we were then starting to, run meetings for burglaries. And I think it was at that point when I was in a prison for the first time running a meeting, and I saw an offender with a horrendous offending history for drink, all sorts of alcohol abuse, violent offending, all that. When halfway through the meeting, he just broke down in tears when he realised, the harm he'd caused. And it was at that point I thought, wow, this is really good stuff. And I would say, really, the last 10 years have probably been about the best 10 years of my working life. So we did that for a couple of years, up until about 2015, 2016, working with the prisons and probation, as I say. And then I went down to London. I'd become the restorative justice manager then for the force, because the team had expanded and we needed a manager. And I went down to London and I saw a couple of presentations there from ladies who'd met the offenders who'd raped them, a number of years previously. Some of them have had to wait, 10, 11, 12 years before they could actually meet the offender, because going back historically, there was very much of an attitude, you really don't want to meet him, you're going to be re-victimised, we know best sort of approach. And yet these ladies were saying, no, I want to see him. And when I listened to their account of those meetings, I thought, wow, that really, really is, emotional and very powerful. So I went back to force and I saw the head of public protection and told her what I'd seen. Because at this point, as a force, and I think probably most providers weren't really doing restorative justice for sex offences. We would do them for what I would describe as low-level sex offences, accepting that, doesn't matter what level it is, you can still call, harm and emotional upset. But to actually run a meeting for that, we'd actually get the permission of the detective inspector and the public protection unit. But I spoke to the head of the public protection unit. She said, yeah, make a business case out and we'll start doing it. And we started then doing restorative justice for sex offences. And in 2017, I co-facilitated one where a lady met the man who raped her 10 years previously. She walked into the room literally carrying a bucket because she thought she was going to be physically sick. And the first thing she said to the guy was, I'm sorry. And I sat there thinking, I'm sorry, and what she had to tell him was she felt guilty. Yeah, she felt guilty. And he was like amazed. Why do you feel guilty? And she'd felt guilty for 10 years because after the crime, she told the police who'd done it. He'd made her promise that she wouldn't tell, and she did, and she felt guilty about that. And also the fact that he'd been sent to prison and wasn't with his wife and family and lost his job, she felt guilty about that. And he just stopped and said, you mustn't feel guilty. I was a predator that day. I acted like an animal. And an hour later, I looked at her after he'd gone out the room. I said, how do you feel now? And she went, euphoric. that's just the best thing, you know. I've got closure. I can now move on with my life. So for me, that raised a question really, because a lot of the time, or all the ones I dealt with prior to that or knew of, had all been victim initiated. This one was offender initiated. And I thought, why are more convicted male sex offenders not coming forward for restorative justice? And to answer that question, in 2019, I went back to university. I'm studying part-time now at Liverpool John Moores, researching why more convicted male sex offenders don't take part in RJ. And it will be a contentious topic. You know, if you have an offender initiated meeting or request, what do you do in terms of the victim? How do you get in touch with that victim without re-victimising them? If they're working with other services, okay, that could be the in. But if they're not working with any services, how do you recontact that victim? So it'll be interesting to see what my research produces over the next few weeks. Because I'm interviewing practitioners at the moment, and then later in the year, early next year, I'm hoping to interview a number of convicted sex offenders who are out in the community to find out what their views are. So we've come on massively in the 10 years I've been doing it. I was just looking at my cases at the moment, and I'm going to fly through them. And I'm not telling you about these for bragging rights or because, you know, I'm the best RJ facilitator there ever was. There will be practitioners like myself up and down the country who will have similar caseloads. And the challenge has been managing them during the last 12, 13, 14 months. And I'm looking at them alphabetically. My first three cases are all for murder. Two of them very high profile ones. One in particular you'd know of if you knew about it, if I was to say the name. Another one, a very high profile locally, you know, a number of children were killed in a fire. And then with a number of sex offences as well. So it tends to be a family friend who's been staying with the family, has abused one of the young boys. Another one, two friends, and it's a rape. You know, she said no, and so that went to court. So we've been trying to run that one. Another one that's just come in recently, another really, you know, horrific rape on his partner. A grandfather with his granddaughters. And another rape of partner, and I'm co-facilitating another one now with one of my colleagues, a rape by stepdad on the three stepsons. So they're the sort of cases that we're carrying and trying to manage. And as I say, that's not just because, you know, in Lancashire we do it so well, that will be happening all over. So it has been hard managing those, because a number of those have come in during the pandemic. The first three, the murders, have come in during the pandemic, as have two rape cases. And I've got two death by dangerous driving cases that have come in as well. The frustration is in the majority of those, or in some of those, I know the offender wants to meet the victim. So they've come in as victim initiated, but because the offenders have already been approached before the pandemic started, we do know they were interested. So the challenge has been to keep them interested. And I have to say, we've been really fortunate in that we've worked with some really good probation staff, some really good prison staff who've kept those links in with the offender, who've kept, you know, sort of reminding the offender about restorative justice. And then from the victim side, again, that's been quite a tricky one, really, because there's nothing much to tell them. You know, so generally what I tend to do is I tend to ring them every 6 weeks or so. So I'll find out how the offender's doing in prison, so that at least I can say, yeah, do you know where the offender is? No, well, that's okay. But he's not moved. He's still in the same prison. He's doing all right. Because again, we don't want to be taking somebody into prison to meet an offender who's got various adjudications or disciplines against him. So I always like to know how the offender is doing, and then I can pass that on to the victim. One of the issues that we do have is where the offender is in denial. So originally went not guilty. And there's one case I've got at the moment, and the case is probably about 14 months old. So started it before the pandemic, saw the victim before the pandemic, saw her again, a few weeks later, just to see did she still want to do it now we'd been through it. And then, the call was then about to go into the prison, but along comes COVID, so that call has never gone in. I sort of look at it and I think, wow, in a few months' time, when that call can go back into the prison, because as you can imagine, the prisons, there's been a fair amount of disruption in there in terms of who goes on the wings, and if they've got offender managers, they might have been going on the wing. Some of the areas, have had COVID themselves. So I just almost know that when that call eventually is put into that man, that he's going to say no, because he was in denial at the time and said that the two girls had both made it up. So that'll be a really frustrating to go back and to say that. So looking at some of the other cases, as I say, the one where the two people who knew each other, the rape and she didn't consent. Again, he was in denial, pleaded not guilty when it went to court. So again, when we saw him, this again was just before the pandemic, was in denial, but didn't want to meet her, but would agree to a letter from her. So that was an approach that we were going to do, a letter. So she has written the letter. We've been in a position where we've not been able to deliver that letter because, for obvious reasons, what we didn't want to do, for obviously, we wouldn't just send it through the post to him. So what we wanted was for that letter to be delivered to him by ourselves. I've met the victim on a number of occasions, so I could go over, give him the letter. And I think it was just before Christmas, I was heading over to another county to meet him with my co-facilitator and the probation staff to give him the letter. And I literally got halfway there and I got turned back because the probation were closing the offices because of the spread again. So that was really, really frustrating. So I've now had to wait another 3 or 4 months up until the current day for him to get the letter. We are actually, as it is, we're going to do it over Teams. So probation officer has the letter. It's a strong letter. So obviously we want the probation officer there just to make sure that he's okay, to manage him afterwards, to point him to other services if needs be. So that's all set up for, what day is it today? Monday. That's all set up for Wednesday. And then last thing on Friday, literally I got an email from probation saying that the offender no longer wishes to take part. So that's really frustrating that we've been, we've had this case for 16, 17, 18 months, and right at the last minute it's fallen. So that's something I need to discuss with the victim and where we go from here. So we've had to adopt a variety of techniques, really, as I say, to manage restorative justice during the pandemic. In terms of what I would call our day-to-day job as well, because our structure is that there are 10 of us, 7 practitioners, and we've got a couple of admin staff and somebody who runs the victim awareness courses. We are supplemented by approximately 40 volunteers as well. So in about 2015, I started to train up a number of volunteers to deliver restorative justice for us, which they do. So what I would call the lower level crimes, the antisocial behaviour instances, the volunteers tend to get those, leaving the more experienced practitioners to deliver the RJ for the more serious cases. As you can imagine, with lockdown, it's been really difficult to deliver those cases as well, because we've not been able to go into people's homes. It's really difficult, So we had, when the first lockdown was eased, if you remember, the weather was quite nice. So I went to a bail hostel in Blackburn, and was sat outside in absolutely, because we couldn't go in, sat outside in absolutely baking sun. And as you can see, if I put my head down, I've not got a lot of hair, and within 5 minutes my head was absolutely turning red. And I remember saying to the offender, "Have you got any suntan cream?" And he went, "Yeah, I've got some in my room." And I was like, "Off you pop." And he comes back about 5 minutes later with some Factor 50 cream, and I'm there putting it all over my head. So we've had to adapt to all sorts of things, really. Again, when lockdown had eased, I delivered an RJ meeting for between 2 ladies who are in a hospital in the Lancashire area with some mental health issues, but the doctors said they had the capacity, so we had to run that. But as you can imagine, you know, we were sort of, well, it wasn't lockdown then, the lockdown had been eased, but actually go into that hospital and having to clean rooms down, going into sterile areas. The two ladies hadn't quite got the head around COVID, so they wanted to shake hands with us, and one wanted to sit right next to me, and it was like, you know, no, get away sort of thing and all that. So we've had to adopt in many ways. I was talking to my colleagues. Funnily enough, we've still had about the same number of referrals in. So we've had lots of referrals coming in. Some we have actually been able to deal with. As I said, we've done some face-to-face. We've done some telephone mediation. So we've spoken to one party, heard what they had to say, spoken to the other party, heard what they had to say, and then you're saying to the parties, right, what do you want out of this process? And if it's, you know, antisocial behaviour, it might just be, you know, tell him not to keep putting his bin in front of my drive, or something like that, or whatever it happens to be. So we've managed to get some agreements like that, and we've sent paperwork out and allowed a period of time for the paperwork to come back before we handle it. So people have signed up for agreements. What we have found is that in terms of referrals from the police officers, we've had less coming in for drunkenness offences or incidents involving drunkenness, and that's basically because people haven't been able to go out. You know, there's a period of time when the pubs were open, so people would have a drink again, so numbers went up. But generally, the RJ for drunkenness has gone down. What we've found is, though, that the antisocial behaviour ones have tended to gone up because people were at home. You know, they're perhaps having a drink at home, so they were annoying the neighbours because they're, you know, making more noise or whatever. So we've had more calls for that. And again, where we've been able to, we've tried to facilitate those. But I have to say, it has been really difficult over the last 12 months or so to run those sort of meetings.
3 minutes, Phil.
Say again, sorry?
3 minutes.
Yeah, that's fine. I'm sort of, I mean, that's a whistle stop tour. I'm more or less done. In, you know, if somebody's got questions now, I'm more than happy to take the questions.
Okay, sorry, I didn't want to break your flow. We've got a question from Jeff here. Is there any incentive for offenders to participate in terms of parole or early release? And if so, does this raise any concerns about their motivations?
The answer is no, there's no incentive. I mean, and that's a good question. Whenever I ring a victim and say, you know, such and such a body in prison wants to see you, the first thing they'll say is, what's in it for them? Are they doing it because they want to get parole, etc., etc.? So no, so I always say they don't get, you know, it doesn't get them parole, it doesn't get them a better cell, it doesn't get them better food. However, what I would say is, if you've got an offender in prison who's been in for a period of time, if he's done every course he should do, he's had no adjudications, he's been a model prisoner, he's worked, he's had a good job, he's done restorative justice. If you add all these things up, that might have an effect on parole. But on its own, no, it doesn't affect the parole process. And the offenders are doing it because they want to do it. We will see offenders a number of times. I dealt with a case. It was a murder case from down south, actually, and the offender was in prison in Lancashire. I think he got something like 17 years or whatever. Before we ran the meeting between him and the mum and auntie of the young boy that died, I met him in prison 10 times. So on 10 occasions, I went into the prison to see him, to prepare him. So I knew when we went into that meeting, he was doing it for all the right reasons. So, yeah, don't get anything for it. And we make sure that they're doing it for the right reasons. Thanks,
Phil. Do they run the RJ in conjunction with the sex offender treatment programs in prison then?
We haven't had, I'll be absolutely honest, we haven't had many through from the prison. We were doing some work with our local prison, Weimar, which has got 650 sex offenders or whatever. So they are aware, and in fact I've actually trained 3 of their staff to deliver RJ, but we haven't had any cases come through. And I think this is the point I was making before about the offender initiated. Are there offenders in there who would be suitable to do RJ? And if they are they coming forward? And the answer is not at the moment. So why not? And as I said, that's the purpose of the research that I'm doing.
Yeah, it sounds really, really interesting, Phil. Has anybody else got any questions for Phil? I wonder what sort of cohort you think you're going to get together, Phil, for your research. How many are you doing it on number of offenders or number of victims, or?
No, I mean, there's a lot of research out there on victims and benefits for victims and why victims take part. There's nothing out there particularly for offenders and offender initiated in particular. So initially I was thinking of interviewing 50 offenders who are in prison. But that raises issues in that, have to get permissions off the Ministry of Justice, rightly so. So I'd have to, that's quite a lengthy document to complete. And then the logistics of getting into the prisons, which isn't too bad actually, because I can actually what we call draw keys at Wymot. So effectively I can let myself in and out, So getting access to the offenders wouldn't be overly difficult. But as I say, it's just easier if I choose offenders who've been in prison, who are in the community in Lancashire. So I'm just doing permissions document now to the Assistant Chief Constable to allow me to approach some of the management of sex offender violent officers, so that they will help me identify 50 convicted male sex offenders who are now out in the community being managed by the police. So that permissions document is almost done. It'll be going in soon to go to the ethics committee, and then hopefully later in the year I'll be able to start interviewing the offenders.
Wow. I've got another question from Rachel Ward. Do you have a view on the Victims' Code of Practice with the right to receive information about RJ? And how effective is this in raising awareness? Does it need to be reiterated at other stages of the criminal justice system?
Somebody's obviously read the Code of Practice. Yeah, I mean, the latest crime survey for England and Wales estimates that only 4.8% of people recall being offered restorative justice. The Victims' Code says that everybody should be offered it. There's no ifs or buts or except for, it's everybody should be offered it. I think the issue is when that offer goes in, if you've got a particularly traumatized victim or a really angry victim, are you going to put that offer of restorative justice in then? You're probably not. You're going to wait. But when you wait, who picks up that offer later on down the line? And I think that's where we miss a trick, really. Sometimes we assume probation have put it in, or sometimes they perhaps assume that we put it in. We have witness care units. Should they put the offer in? So I think we do need to do more work on it. I think a lot more than 4.8% will have been offered restorative justice. They've probably just not used the words restorative justice, or the offence could have been that long ago that they can't recall and they've just forgotten they've been offered it. But we do definitely need to put more work in. There's no doubt about that. And I know that some of the consultation process, some people were suggesting that actually the code should become law, and therefore it would be law that you had to put the offer in. But they've not gone as far as that.
Well, Rachel's saying that's a shocking statistic, Phil.
Yeah.
4.8% by me.
Yeah, absolutely. I mean, like I say, it will be higher, but it'd be interesting to know what the real figure is.
I've got another question from Anna. Would you say that the COVID-19 has helped expose better the advantages of RJ to the public, to criminal justice practitioners and the police?
I would say no, really, because we haven't really promoted it as much as we have been. My role as well as a practitioner is to promote RJ in Lancashire. I think as the police, we probably do most of the probably 90% of restorative justice work. So on a day-to-day basis, I go around all the partner agencies, the prisons, the probation, the youth offending teams, schools, universities, promoting restorative justice. I've hardly done any of that because we just couldn't keep on taking cases that we can't service. So we've just started to open up a bit now. I'm going into Kirkham Open Prison tomorrow to see an offender. I'm going to Preston on Thursday to see another offender, and then I'm going over to Wealdstone on Tuesday. So we've just started doing visits again to the prisons to see the offenders.
Okay. I think you mentioned before about offenders being in denial and things. What's the sort of threshold for them taking part? I mean, if offenders kind of are on the fence about it and they're saying, well, I don't think I did this, but I'll still go along. I mean, do you go ahead?
Well, one of the cases I was telling you about, the lady will say that her offender, I think he said she can come and meet me, but I'm not going to say anything. So he wouldn't accept any responsibility, wouldn't say sorry, but at least gave her the opportunity to come in and tell her version and tell her how it made her feel. And she said, you know, she came out the same thing. That was so good. I'm so glad I did that. I've got closure. He knows how I feel. So even though he's not admitted responsibility, I still wanted to do it. And it's very much down to the victim, really. You know, it's victim-led process in that respect. And if an offender is saying, yeah, I'll see them, but I'm not going to say anything, we'd say to the victim, right, what do you want to do? And a lot of them might just say, well, there's no point then. Or some might say, well, yeah, but I still want to see him. But we'd have to see the offender a number of times, because, you know, it depends. He's in denial, but what's he going to say? You know, is he going to say something that will re-victimize the victim? Or so again, I mean, certainly the offender I was telling you about before, I think we saw him probably about 5 times before we deemed him suitable to take part in the meeting. And the lady herself, I think we saw her about 8 times. And we almost role played the meeting with her. If he says this, how will you feel? If you say that and he says this, how will you feel? Because we didn't want her to be, you know, re-victimising the meeting or you know, need counselling again, which she had a lot of over the years. So it's very much case by case basis. Get to see both parties and take it from there.
I think we've got time for one more question if anybody's got anything they want to ask. It's such an interesting subject, Phil. I mean, I just wondered how much data that there is on, especially for your PhD, the sex offenders and, you know, RJ. Do many actually take part in this country? Is it quite a new thing?
No, you know, we get lots of cases coming in, but in terms of sex offenders, very few actually reach a meeting, and that's the same for domestic abuse as well. A lot of inquiries, a lot of cases, but then they just never reach fruition. So there isn't a lot of data out there. And is the truth. You know, there's data from Canada, places like that, Australia, but certainly within England and Wales, hardly any data at all. And that's really, you know, why I'm sort of looking to do what I'm doing.
Rachel was just telling us about a really good podcast called The Punch on Radio 4, where she said a young man who's convicted of manslaughter after being in a fight, and the guy he punched died, and he went through RJ.
Yeah.
So, do you know about that?
Yeah. We've had, you know, similar cases in Lancashire. I mean, they're very common now. It seems to be happening more and more, whether people are stronger or I don't know what it is, but they're quite common. And I did see that one. It is really interesting. You know, it is.
Mm-hmm. Okay, well, thank you so much, Phil, for coming in and doing the talk, and the best of luck with your research. It sounds amazing.
Thank you very much, and thank you everybody for joining in. Thank you.